Hello, I'm Dr.Sanjay Panicker. I'm the founder director of Amrita Homeopathy. We are placed in two locations in Bangalore, at Koramangala and at Marathali. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics, infertility, and liver diseases. When you speak about muscular dystrophy, I remember a very interesting case where there was a family of 4 people, father, mother, and 2 children. The father developed a particular disease where he was finding that the muscles of his legs are going weak. Over a period of time, the legs also became shrunk in its size and he was not able to move his legs. That was a kind of a paralytic effect which he was having on his legs, where the muscle was losing its strength, starting from the feet, extending onto his legs, extending onto his thighs, and then upward for his hands, chest. And over a period of time, he started becoming breathless, and then he expired due to breathlessness over a period of few years. This same condition was repeated in his elder child after a few years, after he reached his adolescent age, and he also progressed in the same manner as his father did, and he also expired. Now, the patient's mother was so worried because 2 people in the family expired with a similar condition. The second son also started showing weakness in the lower legs after a few years, and she started remembering the same pattern happened to her husband and also happened to the elder son. So she was very sad and worried when doctors told that there is a gene which is responsible for it, and certain genetic mutations happen wherein the muscles start growing weak and slowly start paralyzing. There are some people for whom the paralysis happens above downward, for some people the paralysis happens below upward. There are 30 different types of muscular dystrophies, and in each the reasons are different, the pattern is different, and the way it presents is different. Whatever it is, these all conditions have a gene which is responsible, and there is a mutation in the genes which is responsible for this paralysis which is happening. In this patient, for the child who had, he was about 17-18 years, and he was developing this paralytic condition where it is progressing from below upward. So in this patient, we used a remedy called as Vipera, where the patient's paralytic symptoms slowed down, and over a period of time, it got arrested. Of course, we could not regain his entire motility, but he did not progress towards as fast as the other people in his family did. I treated that case for almost 2.5 years, and the patient is still on medicines. Now we have to wait and watch how it goes. But generally, in this condition, it's a progressive condition where step by step the patient deteriorates and the patient dies because the respiratory muscles undergo a paralysis and becomes breathless and he expires. This is the usual pattern. But this case, till now, there is no progression at the rate at which it had progressed for his father or for his elder brother. So homeopathic medicines can definitely slow down and sometimes even arrest. I have not known any cases, though I have heard some cases that some of the doctors have treated where it has got reversed. So hopefully we should be able to do something like this for this patient also. Anyway, right now the progression is kind of halted. We are not seeing any further increase with this medicine called as Vipera, and we are expecting that the patient will recover subsequently. So this is about dystrophies. Phosphorus is again a very useful remedy for this condition. Generally, that when certain snakes, when they bite, it causes a paralytic effect on the body. In homeopathy, we use certain snake poisons also as remedies. When it is converted in a diluted form, in a very highly attenuated form, where even a trace of microscopically or chemically we don't find any poison in it, but the remedial effect of it is brought forward, and it helps in curing the paralytic effect in a lot of paralytic patients.